Columbia University, we have a history and a tradition of great research, and to have a productive and successful research program, and if we want to find those complex and difficult answers and discoveries, we need to be able to recruit the right people, the right scientists, the right physicians, clinicians, engineers.
Cardiac malformations are the most frequent malformations in humans, right? It's almost one birth out of 100. And among them, a lot of babies have issues with valves, with cardiac valves. I'm very interested in taking care both from a clinical standpoint and also from a research standpoint about these patients who have valve diseases.
The first day after he was born, they told us he had a murmur. And they were like, oh, newborns, they can have a murmur, it's normal, don't worry. But second day, murmur was still there. They ran an EKG and an echo, and then they came in to tell me that it was abnormal.
You have a newborn and you're over the moon and thrilled that, obviously you have this child who you think is healthy, but then to hear obviously on the flip side that there's something wrong is a complete low. It takes you to the other side of the world.
I didn't understand what any of it meant. It kind of floored me to where I'm like, is he going to be able to, run? Is he going to be able to play? Is he going to, all these thoughts came to my mind.
The doctor who saw him when we were at the hospital where he was born, took a wait and see approach. It was nerve-wracking to hear because you knew that at some point something could drastically change. We ended up at Columbia. We went for an appointment just as a secondary second opinion.
The heart has 4 valves in it, and it's very common in congenital heart disease for one or more of the valves to be affected. The aortic valve, like in Beckham's case, actually has 3 leaflets, and sometimes during development the leaflets don't actually separate. His aortic valve, it had 3 leaflets, but actually all 3 of them were sort of stuck at different amounts. The heart's a muscle, so it's like having to generate more pressure to try to force the normal amount of blood out a tinier hole. If you don't relieve the tight valve, the heart's going to get tired really fast. And in little babies, newborn babies, when they're born with significant or tight aortic valve stenosis, they can get sick really fast. And in Beckham's case, his heart was already starting to fail because it had gotten tired.
I think we were there before the door even opened that morning. From the moment we walked into the pediatric card unit at Columbia, we felt like we were at home. The staff, the nurses, everybody there who cared for Beckham from that first day that we met her, and especially Dr. Vincent, who really made Beckham feel like he was one of her own, was second to none.
Fortunately, we did all of the imaging, and I listened to Beckham, and it was clear that he was going to need a procedure immediately, like the very next day, and they weren't going to be able to go home. I called in my colleague and the head of the cardiac catheterization lab, Dr. Torres, assuring them that they were in the best of hands for Beckham's procedure.
Basically on the catheterization, what we do is we put a catheter in the artery and we cross the valve, and then we use a balloon to open the valve. In the case of Beckham, we have a very good result. He was left with no obstruction at the valve and basically no leak.
Once Dr. Torres came out, he just said everything went perfect, and I said, perfect? Like, say that again? He was like, the best possible outcome, and then I was just so happy, and then I couldn't wait to see Beckham.
The fact that he can have a normal life, an incredible quality of life. No football, no hockey, but that's all right.
Okay. That's okay.
He can do whatever else he wants.
He's a spunky kid.
He's got fight, that's for sure.
A lot of energy, makes you laugh all the time.
And very, very curious, very inquisitive.
Likes to now crawl and try to walk and get into everything, so.
Enjoying every moment of life.
Yeah, and we're enjoying it too.
If your child, God forbid, has cardiac issues, go to Columbia. Call Dr. Vincent, her office, because the care you'll receive, just as we did, is first rate, and there's no other place you would want to be.
Our vision here at Columbia University Medical Center and in the Division of Pediatric Cardiology and the Cardiovascular Surgery is to cure heart disease, whether that be one gene at a time through Dr. Targoff's work, one cell at a time through Dr. Lee's work and the stem cell work, one valve at a time through David Kalfa's new program and valve research, and one heart at a time. And the only way we can do that is through one team at a time or one family, which is our team and the Baby's Heart Fund family.